Isoniazide, I want you to automatically think of, when you hear isoniazide or INH, I want you to think of tuberculosis. Okay, this is the reason we give this medication. It's given in the treatment of tuberculosis. The way that it works in tuberculosis is that it inhibits the synthesis of mycobacterial cell wall, thereby hoping to stop the proliferation of the tuberculosis. So if the TB bacteria becomes active in the body and our immune system can't stop this bacteria from growing, this is when we have an active TB disease. A lot of times it's going to occur in patients who are living in close quarters or in underdeveloped countries. The treatment for TB is very tedious, okay? The patient will be required to take several drugs for 6 to 9 months, and the US FDA, they actually have 10 drugs approved for treating TB. There are 4 drugs, however, that the CDC recommends as the first-line defense against TB, or the first drugs that should be given to a patient that's experiencing TB. These medications are isoniazide or INH, rifampin, pyrazinamide, or ethambutol. These are the 4 drugs that, combination of these drugs, will be given first-line treatment of TB. What the CDC recommends, and I'm going to tell you exactly what the CDC recommends because this is an important phase to understand. This is an important regimen to understand. What will happen is the patient with TB will have to go through an initial phase of 2 months, followed by a couple different options for the following 4 to 7 months, for a total of 6 to 9 months of treatment to try to take care of the TB. Okay, so the preferred regimen, this is what the CDC recommends as a preferred regimen, is you would take all 4 of those drugs, INH, rifampin, pyrazinamide, and ethambutol. You would take those for 8 weeks, a total of 56 doses. And then going on beyond that, you would take INH and rifampin for 126 doses, or about 18 weeks, or you could take 2-time weekly INH and rifampin for 36 doses, 18 weeks. There's a couple alternative methods as well, but as you can see, there's a couple different regimens you would do, but by combining these 4 drugs, we can really start to attack this TB and hopefully resolve it. Okay, so you would combine all 4 drugs, including INH, for 8 weeks, and then going beyond those 8 weeks, you would continue for another 18 weeks with INH and rifampin. Now, the problem with TB is that you can develop drug-resistant TB. Just like you can with other infections and other bacterial infections, is the bacteria can become drug-resistant. Now, what happens when TB becomes resistant to at least one of these medications is that you have drug-resistant TB. The TB can also become multi-drug resistant, meaning it can become resistant to one of the anti-drugs and INH or rifampin. So if it's resistant to INH plus ethambutol, you would have multi-drug resistant TB. Treating this becomes incredibly difficult. Okay, it's much more difficult to treat this because we really need to combine these drugs to resolve the TB. Some things we'll want to keep in mind with our patient who's taking isoniazide, first of all, is to let them know that this has to be monitored very closely. We need to be giving this medication daily. Patients should avoid foods high in tyramine, things like pickled meats, aged and smoked meats, alcohol, exotic foods, and cheeses. It can cause peripheral neuropathy, seizures, and hepatitis, and it can also cause, jaundice. We want to monitor our liver function tests very closely because of this. So the biggest thing, like I said, to keep in mind is monitoring the patient very closely, letting them know you're going to be monitoring them closely. And look, the liver side effects are bad, but it's much more important that we treat this TB and get rid of this TB. This has been another episode of the MedMaster Podcast by nrsng.com. To get our free cheat sheet covering the 50 most commonly prescribed medications, head over to nrsng.com/50meds. That's nrsng.com/50meds. Thank you so much for joining me today, and thank you for being part of the NRSNG family. We're here to help you succeed in nursing school and in life. So start your journey today over at nrsng.com/50meds. We're glad to have you aboard. You know what time it is now. It's time to go out and be your best self today. Happy nursing, y'all.